let me extend my warmest wishes for your new year. I hope you had a great holiday season and now almost back to work. My name is Randall A and I'm an infertility specialist in Orlando, Florida. And today we're going to be talking about a topic that comes up time and time again in my practice. It involves reversal of sterilization. About 750,000 women in this country have their tubes tied. Now they can be tied with clips or bands, they can be cut out, they can be burned, but there's some interruption of the fallopian tubes. And we can put those tubes back oftentimes. It's called a tubal reanastomosis or a tubal reversal procedure. I'm asked commonly, which is better for me? Should I have my tubes retied? Should I put them back together? Or should I do in vitro fertilization? And that's a great question on many levels. I think the answer is very patient specific. I'd like to review the two procedures with you, and then we're going to do a little bit of a cost analysis. On the left here is a patient who's undergone tubal sterilization. The first portion of the fallopian tube is interrupted from the second portion. In the second panel here, we see the first part of a tubal reversal procedure. What's happened is that we have basically freshened up the ends, we've cut off the scarring, and now we can see the channel of the fallopian tube. This is typically done under an operative microscope or under laparoscopy where there's magnification of the fallopian tubes. Now in the next panel here is what we would see under the microscope or through a laparoscope. We're seeing the tubes magnified, and what we do is we will connect the tubes at 12 o'clock and 3 o'clock, 9 o'clock and 6 o'clock positions and pull them together. And then after they're together, we sew up the serosal layer, as it's called, the serosa, the outer glistening layer outside of the tubes. Now, this last panel shows what the tube should look like once it's reunited. And the way we check this is we'll place some water-soluble blue-colored dye through the cervix and uterus, and we'll make sure that that is watertight and that we can see that dye through the fallopian tube. So that is a tubal reversal procedure. Now we're going to take a look at the IVF procedure. Now in a previous episode we have covered in vitro fertilization, but this top panel shows the first step of IVF. We have to stimulate the ovaries, usually with injectable medications, to induce multiple eggs. Now normally in the human menstrual cycle there's only one egg, but in our program, for example, we get an average of 11 or 12 eggs per patient. The second panel then shows the ultrasound, and this red line is a needle going into each of the follicles, and then we would be collecting the eggs in test tubes. So this final panel shows that the eggs are now in a petri dish, and 4 to 6 hours later the sperm are added to the eggs, embryos develop, and then 5 days later, usually, the embryos are placed into the top of the uterus under ultrasound guidance. So that is IVF in a nutshell. So which is better? Should we put the tubes back together or should we do IVF? Well, as I said a few moments ago, it's a highly personal decision. One has to consider the number of children desired, the clinic success for this procedure. Fewer and fewer surgeons are performing these procedures. What is the clinic success for in vitro fertilization? How much time do you want to spend off of work? This takes more time than this. And one other decision you have to make is, what do you intend to do about contraception after this procedure? So if you have your tubes put back together and you only want 1 or 2 more babies, then you're dealing with some other means of contraception. Now I mentioned a few minutes ago that 750,000 women will undergo a sterilization procedure, but 1 in 4 to 1 in 3 will have regrets, and many of those will find themselves in a clinic such as ours. Usually those are women who had sterilization at a younger age and who have remarried, where their second spouse does not have any children. When this decision is being made, your physician will want to consider the semen analysis, your body mass index, other reasons that you might have for infertility, for example, previous infection and scar tissue inside the pelvis. So those are all considerations as well. A recent study from the University of Illinois showed, however, that the tubal reversal procedure is cheaper and is more effective than IVF if you look on a pure cost basis and if you throw in the twins and multiple gestations over here. But if you just look at the cost, they're very comparable. And if you add in extraneous cost, such as time out of work, then IVF may make more sense for you. Very, very difficult decision, highly personalized. You need to make it in concert with your partner, with your doctor, and maybe with your financial counselor. Now I'd like to tell you about a recent IVF patient. Very lovely lady, but she did not understand much English. And we had a very crowded waiting room the day that she was going to undergo this last step, the embryo transfer. And on 3 different occasions, my nurse said, "Okay, please take a seat in this waiting room." But she found the wrong door. And she was already dressed in one of those funny hospital gowns where the backside shows. And she went ahead and took a seat in our lobby, and we couldn't locate her anywhere in the clinic. Ultimately, we looked in our lobby and we said, "Okay, please come back. It's time for your embryo transfer." And she mooned all 20 patients in the lobby. So that's not the way to do an embryo transfer. Anyway, thanks for joining me. Happy New Year. Look forward to seeing you next week. Be sure to share this video with your friends and subscribe to catch all new episodes each week here on the Infertility channel. Plus, follow us on Facebook and Twitter. I love hearing from you. Comment below or tell me what you want to see on future episodes by sending me an email to comments@infertilitychannel.org. Until next week,